So we're doing more health issues, and ending malaria now is the focus of this year's World Malaria Day. According to the Ghana Health Service, malaria tops outpatient department cases and is responsible for the death of 3 children every day in the country. In 2016, 10.4 million cases of malaria were recorded in the country. This morning, the Ghana Health Service has been holding series of activities to mark the day. Here at JoyNews, we are on focus on the treatment of malaria. And in the studio with me are 2 fine gentlemen, Kafui and Richard Dumfe. They are practicing pharmacists and they belong to the Pharmaceutical Society of Ghana. They are also collaborating with the Malaria Control Board, and they also belong to the Pharmacists Educating the Public, PEEPs. Is that correct?
Yeah.
Okay, so you're welcome, gentlemen.
Thank you.
It's very refreshing to have you here. So let's begin with the theme for this year's Malaria Day, ready to beat malaria. Are we ready, Richard?
Well, I think the whole part of being ready is a process, okay? But to some extent, I'll say we are ready, and yet in the same breath, I'll say we aren't. So a lot goes into being ready to beat out malaria. So what are we doing as a people? What are we doing as health professionals? And what are we doing as a nation in all to contribute to booting malaria out of Ghana? So I'll talk in terms or in the perspective of the role we are playing as pharmacists. Of course, we only come in when the treatment session is reached. And that is the role that we come into play to beat malaria out of Ghana. And one of our focus this time around is to ensure that people are tested before they opt for treatment. So that is our focus as pharmacists, and that's how we are preparing to get ready to boot malaria out of Ghana. Okay. And
Kafui, if we're ready, it means that we should pick some signals that shows that we're ready. I know that we are at a crossroads now because a long time, I mean, for some time now, we've been able to achieve some success in the fight against malaria, but it looks like the progress has stalled. We're not moving forward. What do you think is accounting for this?
I think generally because of the success that we have achieved over the years. For instance, malaria deaths, especially in children under 5, has moved from 1,200 to about 600. So it looks more like, in terms of funding and other things that come from the global, global fund, and then the other external donors who usually contribute to it, it looks like it's come down. And then generally, a lot more people are we are not getting a lot of cases within the hospital, so it looks like we are relenting on our efforts. However, it's still very significant, and it's still happening, especially within the rural areas. The fact that we've distributed nets, etc., does not mean that malaria has been totally been eliminated. We still have the cases happening. Some countries have been able to eliminate malaria completely. We are not yet there, but I think that we've come down a little, partly because of the funding gaps from especially the donors that are outside, and especially now that we are moving beyond it, we need to be able to really from within bring our resources to actually battle and then also continue the campaign with respect to malaria fights. So that's what may have accounted for that,
the slow in
progress.
Okay, so how do we deal with this, Richard?
Okay, so we can deal with it with this in diverse ways. So one involves what we are doing right now. So we think that the public should still be sensitized on ways that we can prevent and treat malaria as well. So it's not just the treatment, or we shouldn't relent on our horses and think that we have come to an end in the fight against malaria. The public sensitization should still be ongoing, and people should be made much aware of the consequences of the disease that we are fighting right now.
Okay, and there's also a target which is 40% of malaria incidents and deaths by the WHO strategic technical strategy for malaria 2016 to 2030. And if and I am afraid that with the pace we're going, we'll not be able to achieve this. Do you agree?
Well, with respect to the strategies that especially the National Malaria Control Program has put in place, I'm pretty much sure that if we continue with our efforts, and we intensify our efforts with more resources allocated to fighting malaria, we should be able to achieve that.
Okay,
but so it's very possible.
Okay, so again, trying to achieve this all comes back to the fact that we are ready to beat malaria right now. What role does the individual play in making sure that we beat malaria? We'll go to the treatment, but first, how do we even prevent it before we get to treatment?
Well, I think we've said this over and over, but like I rightly pointed out, there is still the need to educate and sensitize the public about some of these measures that will result in preventing the infection in the first place. So, I mean, we should try to get rid of stagnant waters around us. And if you live in an endemic area, you always try to make sure that you always wear protective clothing, especially at night when you are going to bed. And you can also resort to using, let's say, mosquito coils and then insecticide sprays to kill or ward off the insects. So the prevention is also very important, and we need to take preventive measures seriously.
Okay. Maybe I may want to add a bit of sleeping in the insecticide treated bed nets. It's very important, especially for the people who live in the rural communities. And it's actually being distributed. Today, for instance, they've distributed some around Ashaman and some other places. So the mosquito insecticide treated bed nets, very important. It's the main preventive measure that has been put in place world over, especially in these endemic areas. So we encourage people to still sleep in the insecticide treated mosquito bed nets, especially for children and then pregnant women, because those people are they are the people at higher risk of getting malaria. So pregnant women and then also the children under 5 years, very important that they sleep in these bed nets.
For some time now, there's been this plan of people just walking into a pharmacy to get tested for malaria, and then if you're positive, then you're given medication. And I know government is subsidizing this, but for some time now, it looks like people are not interested in the testing, but they just want to go in for treatment. How dangerous is this practice?
Well, this practice is dangerous, like you rightly put it, and it was part of these dangerous reasons that the World Health Organization decided to come up with the concept of testing before treatment. So the main aim of testing before treatment is to ensure rapidity of the whole diagnosis process, to ensure accessibility, and also ensure accuracy. So if we continue on this tangent, people who don't need treatment will be treated. There will be a lot of over-treatment, and this can result in what we call drug resistance.
Okay.
So you end up giving people who don't need malarials to take. Okay. And then those who even need it, you might even end up not giving to these people at the long run. Okay. So it results in resistance, which also brings some economic burden to the individuals and then the country as a whole.
And apart from that, let's also look at the drugs for treatment. And we know we've gone through stages. We used to use chloroquine, then we came to artesunate, then I think Coartem, and now I don't even know which of them is appropriate for the treatment of malaria. Which ones are the appropriate medications for malaria right now?
Okay, so currently we have what we call the ACTs as artemisinin-based combination therapy. So we are no longer using just one single molecule like we were doing maybe chloroquine or just artesunate. Now it has to be a combination of what we call the artemisinin-based combination therapy. So those are the class of medications that we have. There are basically about 3 of them. We have artemether-lumefantrine. We also have artesunate-amodiaquine, and then dipiperidine, what we call PLX, that's a specific brand. So those are the 3 main first-line medications when it comes to malaria treatment. Like you rightly said, we've moved from chloroquine and now we are doing combinations. The reason is that people are abusing it. We're over-treating malaria. Yeah. Sometimes people even start treatment and don't end it. Yes. So once they begin to feel well, they stop taking the medication. That's very dangerous. Because of that, the parasites got exposed to the medication. Because you're not able to knock them out completely, they also change their structure. That's what we call the resistance. So with time, when you give the same medication to a patient, you don't get the recovery that you expect. And so as it stands now, that's why we are now doing the combination of the two drugs. And it's all because of how we were abusing medications. That's why it's important that now we are stressing on the fact that people need to test before we treat, so that we are sure that we are only treating patients who actually have malaria. The symptoms of malaria are quite similar to a lot of other conditions. It's possible you may give a malaria drug to someone even though the person doesn't have malaria, and then you fail to really target what really the person may be facing. And then the other thing is that the adherence rate is also very low. People don't complete their medication. So it's very important. We want to really fight the resistance patterns, and even as it stands now, some people have recorded resistance in certain parts of the world. So we need to protect what we have, the arsenals that we have, our weapons, which is the medications, by making sure that we test before we treat.
So PEP, what role do you play? We've acknowledged the fact that people go to pharmacies, they don't want to be tested just because they're feeling weak, they feel they have malaria, and so they want medication. And then we've also identified the fact that people just walk into pharmacies and then say, I want to buy this because I think I have malaria. What role do you play in ensuring that the right things are done?
Okay, so one of the roles that we play also actually lies in advocating. So as it stands now, we are advocating, and even if you walk into any pharmacy, like we rightly pointed out, we are an offshoot of the Pharmaceutical Society of Ghana, and then it is the main umbrella society of all pharmacists in Ghana. So we are advocating that when you walk in and you want to buy any malaria medication based on the signs and symptoms that you are showing, as members of the society, we'll encourage and ensure that you get tested before we give out the medication. So we are spreading that message far and wide. I mean, with respect to malaria, and PEP does a lot of educational programs, but then with respect to malaria, we are currently advocating and forcefully ensuring that a lot of people get tested before they are treated for malaria.
And with the pharmacies, do you have any monitoring mechanism to ensure that the pharmacies are doing the right thing?
Okay, so there's a regulatory arm, and the Pharmacy Council regulates the practice of pharmacists in Ghana. And there's a new organization called the HEFRA, which regulates the health facilities. So those are the people who actually go on to do the monitoring. We as a professional body do not necessarily go around, but when we go for our AGMs and all that, we try to encourage our colleagues to make sure they do the testing before, because basically pharmacists are custodians of drugs. We are supposed to protect the drugs that are available to us. So we try to encourage a lot of people to do the testing before they give out the medications. As if the person comes without a prescription.
Okay, and despite all these activities going on, trying to ensure that the public adhere to the right things, we still know that we are at a crossroad, and the achievements we've had, if we don't take care, we may not be able to reach where we want to go. And of course, the achievements we've had, we may even retrogress. So it means that we need to do a lot more. Exactly. What's the action plan?
So the action plan, like we've rightly stated, first of all, we want to encourage what we call the 3 T's of malaria management. That's to test, treat, and then we track. So we don't only test, treat, but we also follow up to really accessible within the communities. So that's one very good stride that we've been able to achieve. And then again, it's also and then also the prevention is something that we are very key. When you go to the pharmacies, we try to also educate a lot of people on how to prevent malaria. If you come for malaria treatment, we try to educate you about how you can protect yourself. We recommend the bed nets, the insecticide sprays, repellents, etc., to help people to also prevent, so that we don't only wait till the person gets the malaria before we treat.
And just to add to what he's saying, so we would also we'd also like to encourage the general public to bear with pharmacists when we subject them to these 3 T's: the test, the treatment, and the tracking. At some point in time, we feel some patients being quite uncomfortable with one stage. A patient might not be comfortable with the test and just wants to go ahead and treat, and probably will not want to be tracked to give you feedback or let you know what is going on with the medication. So it's a whole process, or it's a procedure that our clients should be ready to be subjected to, so that at the end of the day, we can achieve the goal of kicking malaria out of the country.
And one interesting point you raised earlier was the fact that people don't complete their treatment. And of course, we know that that could be very dire to your health. Throw more light on that and let the public understand how dangerous that practice is.
Okay, so the main issue surrounding not finishing your medication has got to do with resistance. So, I mean, I'll just try to break it down as simply as I can. So, when you are giving a drug to maybe cure you of an organism that is causing an infection, the drug is supposed to work for a number of days and at a particular concentration in your bloodstream. So, before you achieve that, you need to take the full course with the duration that has been given you. So when you're not able to take the full course, it's like you are just playing with the organism. You are not completely killing the organism. You might just end up weakening the organism. And when this happens, the organism also tends to develop mechanisms of fighting the drug or pushing the drug out of the system. And that is what results in resistance. So with time, we get to get organisms that are resistant to that particular drug because we haven't completely kicked them out of the bloodstream with a full dose with a full duration. So that is what happens. So if we don't take our medications as required of us, we are only contributing to drug resistance.
It's amazing, but today is World Malaria Day, and of course it means that we should learn a lot of things about malaria. Any advice for the public?
Yes, our advice basically is to encourage people to speak to, whenever you have the symptoms. It's important that you speak to a health professional to give you an advice as to how to go around it. Then also, we also want to encourage people to take preventive measures. Make sure your environment, everything is kept well. And we also want to encourage people to also listen to advice of health professionals. Complete your medications. Make sure you test before you treat.
Well, many thanks for joining us on World Malaria Day.